Okay, so what does the research show now when it comes to smartwatch accuracy for detecting sleep? And how are they validated as well? Generally speaking, we want to use a gold standard as our reference point. If you go to the hospital and you're there for a sleep study, you're usually going to undergo something called polysomnography. And this is generally speaking the comparison point that you want to use your device to compare to, just because polysomnography is what is most commonly used, what is considered to be the reference standard, and provides the most accurate and usable information as well. What happens is when you go to a sleep study, they'll gear your head up with a bunch of electrodes, and that's to look at your brain electrical activity. Not only do they gear your brain up, but they also gear up your body with some other electrodes as well to monitor your electrocardiogram. And this isn't in all cases, but in some cases, they want to see your heart rate and everything as well while you're undergoing the sleep study. Besides the electrodes, we also have microphones that are sometimes attached to the patient and other breathing devices as well. And these are usually done to assess sleep apnea and the amount of snoring. With all this equipment attached, we get a really, really good understanding of what stage of sleep the patient might be in from the brain activity. We get to understand, based on the respiratory rate and heart function, are there correlates from those that also tell us more information about what sleep stage they're in. And really, if you are wearing a watch and undergoing polysomnography at the same time, it becomes a really good approach to assess accuracy of some of these watches. Sometimes these smartwatches are compared to actigraphy, and really actigraphy, again, it's an activity monitor, right? So you have accelerometers that are built into some of these watches. And actigraphy becomes really, really good for comparing total sleep time and sleep efficiency, which again is the amount of time you're actually asleep as a ratio of how much time you spend in bed. When we take a look at the literature, we tend to see of course, generally consumer-based watches. So things like the Apple Watch, the Google Pixel watches, the Samsung Watch as well. I think it's the Galaxy Watch, the Fitbit, and of course there's an Oura ring as well. So again, you just put the ring on and it can measure your vitals just from a ring-based approach rather than a wrist-based approach. And these are all considered to be wearable devices. So, devices you can have on at any time you want, and when you go to sleep, it can just continue to monitor your sleep function as well. When it comes to comparing these devices to polysomnography, as far as the five listed here, the Google Pixel Watch, the Galaxy Watch, and the Fitbit seem to be the best when we're correlating to sleep stages. Okay, so they're better apparently than the Apple or the Oura Ring. And really, the big thing is that these watches are best at identifying differences from NREM to REM sleep. But when you start looking at deeper and deeper sleep stages, that's when some of the accuracy in these watches is lost as well. So, Google Pixel Watch, the Galaxy Watch, and the Fitbit seem to be some of the more accurate ones when we're comparing sleep stages. Now, when we're looking at sleep efficiency and sleep latency, this is quite different as well, because here it depends on the type of watch. So the Galaxy Watch seems to be the best for sleep latency, but the Galaxy Watch seems to be the best for sleep efficiency. But for sleep latency, on the other hand, the Apple Watch seems to be the most ideal one. When it comes to some of the other aspects, again, the watches have very specific strengths. These are all compared in healthy individuals in polysomnography, but it becomes a little bit difficult to state which one's ideal because they all have certain strengths, certain weaknesses. They all monitor certain sleep parameters better than other watches. And really, they all have relatively similar correlations to polysomnography, but they all have quite a bit of error associated with them as well. So, generally speaking, these watches aren't at that specific usability yet where you can monitor sleep stages and sleep efficiency to a perfect ratio in comparison to polysomnography. But hopefully, slowly over time, they can get there. There was, again, another study as well that also included Garmin alongside the Fitbit watches and the Oura Ring. And similarly, for total sleep time, the Fitbits seem to be really good. The Oura Ring seemed to be good as well. And in this case, the Garmin wasn't the most ideal watch when it comes to sleep efficiency. But other studies have found, different findings as well, where they see that the Garmin is actually more accurate when it comes to sleep efficiency. Really, these watches tend to either underestimate or overestimate, a lot of these parameters. And for things like wake after sleep onset, none of them seem to be that accurate. But generally speaking, for sleep efficiency and total sleep time, you can get a relatively good estimate, right? So if all you're looking to see is, okay, how long did I spend in bed, and how much of this time in bed was I actually asleep? All of these options seem to be usable for this. But when it comes to specific sleep stages, none of the devices are actually that accurate. And all of them tend to overestimate or underestimate which stage you're in. And because of that, if you feel like you're having problems with your actual deep sleep or REM sleep, it's really not advised to take a look at what these watches are showing and actually go see a doctor and get a sleep study done for that. The other last thing to note is these watches are beginning to again monitor this oxygen saturation. And with Apple, it seems like they're doing a tremendous job with this, so maybe that can slowly become a clinical correlate. With monitoring oxygen saturations, they're starting to understand again, do patients have sleep apnea? Can we pick this up with some of the physiological markers and with our oxygen saturation? And hopefully soon it becomes a very, very accurate measure for sleep apnea. Now, clinical conditions, again, are also a lack of research in this area. You need more patient-based research. You need more varying clinical conditions to understand what's going on. And currently, the research just isn't at that stage right now. Most of this comparison or correlation of smartwatches to polysomnography for sleep is done on healthy people. So hopefully in the next couple of years, we tend to see larger and larger data sets of patients, with Parkinson's disease, Alzheimer's disease, other insomnia type of conditions as well. And we can really start to understand, okay, can we use these watches to monitor these specific patients as well? Perfect. And here are my references. A lot of what I have is from my lecturing series or things I've learned over the years, but these two studies here are great. They just recently came out as well, and I would highly recommend taking a look to understand more about the correlation of these watches and sleep. Thank you.